example of how we set up in the low diagonal sit. I'll flip her in a second so that you guys can take a peek as well. Similar to the kind of shin box leg position, but what my goal here is to try to get, now she's on the table, so can you move your elbow up to right here for me? Okay, and then I want this a little bit further back. So I'm trying to go long line through here, okay? This exercise is phenomenal for a handful of things. We're really focused on hip from a mobility and patterning perspective, and then also into a facilitation of glute perspective, both huge benefits. So I can play with the angle of the knee here. I should not be blocking all the people who can see it. I can play with the angle of the knee here to help me get the facilitation I'm looking for. You just gotta kind of mess around with like what level of flexion do we need to get the best out of it. 3 steps to this exercise, and you can use whatever level of cue you like here. I usually have to explain to the patient, I will go, I'm a little teapot arm, right there. Okay, the reason I like I'm a little teapot arm is, can you show me like a compensation with your shoulder? Is like when I say to roll forward, a lot of times patients will roll with their shoulder. And what I say then is, you just wrote a check with your shoulder that your pelvis cannot change. Okay, so then from that point, we don't write bad checks. And now I'm using analogies instead of like having them focusing on their body. So what I like the, I'm a little teapot position because I'm gonna say move your whole torso from where your hand is on your pelvis, leading from there. Yes. And now the only range we get is whatever internal rotation we've got on the bottom hip. Okay? Now upper body could go way further, but that's not the goal. The goal is to get stretch on those external rotators. Okay? Because I'm gonna put them on stretch, and then we're gonna activate them. So now we're gonna call that closing the book. Okay? Go ahead, close the book. And now we have an unlimited debit card. This credit card you have to pay back, you guys. I don't know if you knew that. Back down. I work with a lot of young 20-year-olds, so you never know. I'm here to educate however I possibly can. But you do have to pay that back someday. So what I'd like you to do is drive into me here a little more. So she's driving into her quad into the table, which could be because she's got quad for days. But I need you really to get contact with me, so I'll come up and meet you a little more. It's hard for you. Yeah, this side's not really turning on as much. Okay, undo, let it all go. Okay, close the book. Give me a little bit here, that's all I need. And then float up 1 inch. So it's close the book. I'll say bite the card or bite the bill, $100 bill right here. Don't let me have it. And then just enough for me to slide my hand underneath. Okay, so it's not go up, lift up high. It's not a side raise. I'm not interested in that. Like, and it's cool if they're like side body, like their soft tissue still in contact with the floor. I just want greater stroke hander to offload. So I should be able to slide my hand underneath without tension, but it's okay if the tissue's still in contact. Okay, so close the book, bite the bill, float. Good. Can you roll over and we'll do the same thing for these guys? Question?
So you go to the point where the muscle feels the stretch and then the contraction starts?
I will usually go to max range, but I love the idea that if they're starting to feel that muscle stretch there, that's a cool option too.
Okay.
Yeah, I like that. So as you guys, and you guys have a different perspective now too, let's close that up. Okay, see how she wants to lead a little bit there. It's fine. Like, and I'm trying to have this be the max point. Then we're gonna, I was given a little facilitation here, so I can, like, this is hard for her to get good tension here. She's really driving quad into the thing. It's not her foot. Some people will be driving their foot in and not their knee at all. But like, so what I'll typically do is I'll be standing right behind them and I'll say, don't let me pull you.
Nice.
And I'll just get a lot more activation.
There you go.
Good, and then float up 1 inch.
Holy
Good.
smokes. Wow.
This food is on fire. Okay. You can be both. All I really wanted is people to stand up and sweat here with me, so I didn't feel alone. So thank you guys. Thank you for your support today.